Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be having a conversation with Dr. Chitkala Kalidas. She's joining us here as Vice President and Global Head, Oncology Regulatory Affairs and Oncology Sustainability at Bayer. She's going to talk about the Oncology Sustainability Initiative that was launched in 2021 with the goal of reducing disparities in access to quality cancer care and improving outcomes for patients. Welcome to Health Professional Radio. Dr. Kalidas, thank you for joining us.
Thank you very much, Neil. It's a pleasure for me to be here today.
Well, tell us a bit about yourself and how you came to be at Bayer.
Thanks for the question. I have been with Bayer for about 5 years now. I joined in 2017. Prior to that, I was with another pharmaceutical company for about 15 years. I was attracted to this role at Bayer because of the opportunity to build up our oncology regulatory affairs organization, both on the drug side as well as on the diagnostic side at a global level, and also to be able to have the opportunity to build our oncology pipeline. And it's also the unique structure that we have at Bayer for oncology that attracted me. Our structure is such that we're almost like a small biotech company within a large company. So that was really attractive to me, and it's been a very exciting journey over the past 5 years. We've had a number of approvals that have been precedent-setting around the globe, and it's an opportunity to really bring some concepts forward in the area of precision oncology, as well as developing novel paradigms in cancer drug development. So it's been very exciting, and I look forward to more in the coming years.
Now, I did mention that in 2021, you launched the Bayer Oncology Sustainability Initiative. What is this initiative, and what role do you play in it?
Thank you for this question. Bayer Oncology Sustainability Initiative is, in fact, a very important part of our oncology strategy at the company. This initiative is focused on equitable cancer care. And what we mean by that specifically is that we feel a number of people around the world do not have adequate access to the right therapy at the right time, and even the diagnosis of cancer is delayed in many cases. The reason for this is actually there are a number of factors that contribute to this. One of this is the lack of awareness that a problem that someone has could be related to cancer. And we want to really make a difference in this area because we see that we have a role to play. So through this initiative, we are doing a variety of things. One is spreading greater awareness about cancer, also talking to people about how changes in lifestyle could also reduce the risk of certain cancers, and importantly, how to get the right care and bringing the right care to the patients in the communities where they live. We are focused on underserved communities around the globe, and we started with low and middle income countries like India, Ghana, and Egypt, and we are also looking to expand our efforts into some of the under-resourced or underserved communities in the U.S., for example, where there are similar needs as well. So the role I play in this initiative is that I lead the Oncology Sustainability Initiative at Bayer, and I lead a cross-functional team that's involved in all of these activities. We collaborate extensively with external partners because our strategy is based on public-private partnerships in the communities that we are targeting. And it is a role where I get to link my background in regulatory affairs and apply it to bringing drugs to many more people around the globe. So it's really about improving equity in cancer care and bringing down barriers to cancer care as well.
You know, you mentioned a couple of barriers, obstacles, challenges. What would you say would be the main obstacles preventing patients from getting the treatments that they need? I mean, you talked about some of the conditions in the United States, in middle to lower income countries, but aren't some of the denial of, I guess, for lack of a better term, denial of access or lack of access based in some of the same problem areas, no matter where in the world they exist?
Yes, I think there's a part that's common to many of these communities, and that is the location. And specific locations where there could be a combination of factors that's preventing people from getting access to the right care. One is living in remote locations is a big challenge. If there aren't institutions where people could go to get the right care, or if it puts a lot of burden on families where they have to literally leave their families, cannot care for their families, and then have to go into big cities, and that's the way to get care, where care could be very expensive. That is a common theme that we see across all of these communities. And then lack of economic resources is also another common theme. And thirdly, lack of awareness is also an important issue. And that's why when we look at communities, irrespective of where they are, the common theme is underserved communities anywhere in the globe, and they all seem to have at least these three factors in common, which is the reason, or these factors are some of the important barriers, or they pose significant challenges to people in these communities, and these are the barriers that we are trying to reduce or remove completely.
So in removing these barriers, do you face any resistance? I mean, there's a lack of awareness that these solutions exist. When you bring these solutions to light in some of these areas, what are you met with?
So I would say that we have not met with active resistance necessarily, but one of the things to understand is people generally try to shy away from bad news. So actively looking to see if they have a problem, especially when the symptoms are not clear or when they do not even realize that these are symptoms of something like cancer, it's really motivating people to go to the doctor to talk about that lesion that they may have or something that looks like an ulcer in their mouth, and that it needs to be looked into. Those are things that do not happen naturally in these communities. So one needs to really focus on healthcare literacy, and it does not happen overnight. And there are also people that that can act as community-level counselors, because it's difficult for someone from outside the community to come in and preach to the community that you need to do it. I mean, one can spread disease awareness, but really for the community members to adopt different practices, to change the way they do certain things, it really needs to come from someone that they see as their own, someone they trust. So engaging with local leaders and local community workers is something that we consider to be very important, because that word of mouth is still very powerful at the grassroots level. So it's really acting on the information that is being provided can be a challenge, because there's a certain level of inertia, there's a certain level of stigma in some cases that's associated with getting cancer, certain types of cancer as well. And we want to reduce those types of issues and make it more accessible for people, more acceptable for people to talk about some problems that they are having with people they trust, and then find the right care for themselves.
Doctor, could you give us a website where we can learn more about the developments and initiatives at Bayer?
Sure, www.bayer.com. And we have our projects and other activities that we are doing related to cancer care disparities on our website, and you can follow our work there.
Doctor, it's been a pleasure speaking with you. Lots of great information. Looking forward to our next conversation. Thank you for your time this morning.
Thank you very much, Neil. It's really a pleasure for me to speak to you today.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Chitkala Kalidas. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.